2.
Hi, my name is Tyler. I'm a physical therapy student at University of Central Florida, and today I'm going to go over the application of a contrast path. So the benefits of a contrast path is you're trying to get the benefits of heat, like increased flexibility and decreased pain, without the negative effects of heat, such as increasing edema or inflammation. It's also been proved to that the varying sensory stimulus promotes desensitization to also decrease pain. Common treatments considered for contrast path is chronic edema, subacute trauma, inflammatory conditions such as sprains, strains, tendinitis, or hypersensitivity disorder. Some of the advantages of a contrast bath is you have more circulatory effects than heat or cold alone. Also, you have good contact with distal extremities, so if you're doing a foot or a ankle, the water's contacting all the surface area, which is kind of harder with different kinds of heat and cold applications. You can't really do that. And it also controls pain without increasing edema, which is what we're going to be using it for today. Some of the disadvantages is the limb's going to be in a dependent position, so if you're doing an ankle, gravity is going to be promoting edema. Same thing with the hand if it's in a contrast bath. Gravity is promoting edema. That's one advantage or one disadvantage. Another is evidence is lacking. There's not much evidence to prove that this does what it says it does. So today, my patient has rheumatoid arthritis. So we're going to use a contrast bath for pain relief and increased flexibility without increasing the inflammation in his joints. So rheumatoid arthritis also commonly affects small joints in the hand. So we're going to use this to see if we can get more flexibility, more range of motion, so he doesn't have those stiff joints, so he's more functional without increasing the inflammation. So I got two tubs here, one warm and one cool. The warm is at 105 degrees and the cool is at 55 degrees. And parameters for this, you want the warm to be about 100 to 111 degrees, while the cold's about 50 to 64 degrees Fahrenheit. And you want a bigger temperature difference if you're using it for pain or edema versus if you're using it for desensitization. You want to slowly increase the difference between the two baths over treatment periods. So what I'm going to do is first clear him for contraindications and precautions to make sure it's safe for him to do this treatment. So the first thing I'm going to do is check his hands for any maceration around the wound or any active bleeding. So his skin integrity looks good on both hands. So he's pretty much cleared. And also precautions would be infection, impaired sensation. So we do a sensation test. Go ahead and close your eyes for me and tell me when you feel you touch you. So he's cleared for contraindications and precautions. And have you ever been hypersensitive to cold or heat? You have any metal on your hands? Okay. Hypertension, nothing like that? Okay, so he's cleared for that. So first we're going to put him in the warm water for 3 to 4 minutes and then the cold for 1 minute. We're going to repeat this 5 to 6 times for 20 to 30 minutes. So I got my warm water right here, 105 degrees. Go ahead and put your hands in. Show me both hands. And we leave it in there for 3 to 4 minutes. And then when 3 to 4 minutes pass, he's then going to submerge his hands in the cold water for about a minute. And we're going to repeat that process 5 or 6 times like I said. And I think the most important thing for this is monitor your patient, make sure that they're not getting increased inflammation in their joints. So after the treatment, ask them how they feel, because we really want to make sure we don't